Hello and namaste. This is Dr. Srinidhi Chidambaram with the COVID Care series presented by Apollo Hospitals. With the COVID pandemic affecting us in wave after wave, it is not surprising that by now most of us are exhausted and stressed, in a state of perpetual tension and panic. We sometimes feel that there may be no end in sight and no hope that things will go back to the way they were pre 2020. But we do have the vaccines now and a lot more knowledge on treating COVID 19. So let's hope for better times. One way we at Apollo Hospitals thought we could help you was by bringing facts and information on COVID 19 every day so that you can take on the pandemic with confidence and resilience. People with pre existing conditions and non communicable diseases such as heart disease, diabetes, hypertension, cancer, kidney, or liver disease face tremendous stress, even more than others. As for them, it's like fighting two battles at the same time and not knowing how one affects the other. So, should people with these comorbid conditions take extra precautions? Should they go for their regular checks and treatments and follow up appointments at the hospital? Should they continue their treatments? What will happen if they get COVID? So, we have these special episodes on the non communicable diseases, and we focus on each one of them. And today, we are addressing managing cancer and COVID 19. To discuss this with us, I'm very happy to welcome Dr. Manish Singhal. Dr. Manish Singhal is a senior medical oncologist at Apollo Hospitals, New Delhi. He's a DNB medical oncology teacher as well. Dr. Singhal did his MBBS from the KEM Hospital, Mumbai, and MD in internal medicine from the PGI MS Rohtak. He got his formal training in medical oncology, the DN, from the AIMS, New Delhi. And during his tenure there, he was also selected for training at the Oriel College, Oxford University, UK, and the Barbara Ann Karmanos Cancer Center, Detroit, US. He's the first and the only Indian to top the ESMO, European Society of Medical Oncology exam in 2013, scoring world rank #1. Other than numerous publications in academic journals, Dr. Singhal regularly contributes to public awareness articles in print and television media. He's also a committee member of the Indian Society of Medical and Pediatric Oncology and also the Joint Secretary of the NCR Oncology Forum and a member of many international cancer societies. Hello, Doctor, and welcome to this FB Live of Apollo Hospitals. Let us begin with an overview from you on cancer care during the time of the COVID pandemic and what precautions should be taken by such patients. What would be the severity? What would be the treatment modalities for COVID in case a patient with cancer gets infected? And also about how cancer patients themselves can cope with both their cancer as well as COVID 19 and what precautions they could take so that they don't get it. Over to you now.
So at the outset, very warm welcome to everyone and a big namaskar. We all know that we are passing through very unprecedented times. And this is something which we have never imagined, we have never thought of, and we weren't prepared also. The first wave took us by surprise and the second wave by an even bigger surprise. And I think neither the health facilities were capable of taking a load of so many patients, and neither we were very prepared. And you would have also seen one very important thing, that the guidelines kept on changing, ever changing. Every other day, there were new drugs coming in with some little promise about treating COVID-19. So was something which was going in the background was how to treat cancer patients or non-communicable diseases during this COVID-19 pandemic. And we saw a sea change happening almost every now and then. And it is possible that if you would view a video of any of a senior oncologist a year back, perhaps they would be sounding something very different from what I would sound today. It is because our understanding, our knowledge of this particular pandemic and our understanding of our disease in respect to the COVID-19 is evolving, still evolving. So it is very likely that whatever we speak today may not hold true in the coming future. But yes, it was a learning experience and we have learned a lot. There is no doubt that during the COVID-19 pandemic, we found that the cancer patients were very scared about continuing their treatment, and many of them skipped treatment, so much so that at the risk of progressing, so whatever benefit they actually had with their ongoing treatment, that was delayed. So much so that because of the oxygen deficiencies or the deficiencies in the supply of oxygen, many surgeries were not. So these were testing times, and I understand, and we all know that desperate situations calling for desperate measures. So these were real desperate times, not only for patients, but also for doctors. There's no doubt that the bottom line is that cancer patients are assumed, or they are known to be immunocompromised or relatively immunocompromised as compared to the general population. And in case they contract COVID, because they are high risk, there's definite high risk of contracting COVID because they have to go in and out of the hospital, or they have to travel more than a general person. So the risk is high. And in case they do get infected with COVID, they may have very dire consequences of the COVID-19 itself. So whenever you have, two diseases which are serious enough, and we all know that COVID-19 is much more serious than cancer by itself, because if one has to choose between the two, the cancer is obviously a slower disease than COVID-19. About COVID-19, we know that patients can succumb within days to weeks, whereas cancer is not that rare. But what I'll share today is our own experience of COVID-19 in patients who are suffering from cancer and who are undergoing treatment. So the general assumption is that the cancer patient, whatever be the chemotherapy they are on, whatever be the treatment they are on, they're relatively immunocompromised. But this is a very generalized statement. And it is obviously, one would agree that they are immunocompromised, but somehow or the other, it appears that some immunocompromisation is also protecting them from dire consequences of a COVID-19 infection. What does this mean? Let me just qualify this statement further. So of course, when there were patients whom we were treating with chemotherapy, say for example, a breast cancer patient on chemotherapy, and they contracted COVID-19, almost all of them recovered well without any serious consequences of the disease. So somewhere or the other, it is seen that those patients who are relatively immunocompromised may actually recover faster from COVID-19 than a patient who is immunocompetent, that means a normal human being. We all know from COVID-19 that it is the extraordinary inflammatory surge or the extraordinary immune response to the virus which actually results into the damage caused in the lung, and that causes the patient to become sick. I'm talking of a normal human being. So somewhere or the other, a slightly depressed immune system may actually be slightly protective or slightly protecting them. Now coming to the fact, there's a lot of misconception that the cancer patients are more likely to contract COVID. There's nothing like that. The risk remains the same as is the risk for any person. But after contracting COVID, the risk of they developing in severe consequences as compared to the general person is slightly higher, but not very high. It also depends on what type of chemotherapy you are on. Not all patients of cancer chemotherapy or cancer treatment are severely immunocompromised. They may be relatively immunocompromised, but not severely immunocompromised. Most patients who are on solid organ malignancies, such as lung cancer, pancreatic cancer, or breast cancer being the most common, they may not be severely immunocompromised, and we have not really witnessed that they have much dire consequences. However, patients who have blood-related malignancies, lymphomas, where certain drugs are used which make them severely immunocompromised, not relatively, but severely immunocompromised, such patients definitely have higher chances of having a dire consequence from COVID-19. Now the question is how to make a balance. So whenever the infectivity rate or the positivity rate in the community is very high, your chance of contracting an infection is relatively quite high. That time, it is best avoided to come to the hospital. However, in a hospital where a protocol is being practiced, such as in our hospitals, such as at Apollo Delhi, where we are following protocols for COVID-19 versus non-COVID-19, it is still relatively safe. People ask and they argue that your hospital is a COVID hospital, so we should not be coming to it. Well, my counter argument is wherever COVID hospital is there and they are admitting non-COVID patients also, the protocol is in place. For example, if a CT scan has to be done for a COVID patient, it will be done in the night time. And in the morning, they will sanitize the entire CT scan facility. And in the morning time, they will take the non-COVID or non-communicable diseases patients. So a protocol is in place. The lifts are separately built for COVID-19 versus those patients who are COVID-19 or versus non-COVID patients. So they are separate lifts. It is better to still take treatment in a hospital, which is a COVID hospital, because protocol is in place. Of course, a good COVID hospital, a hospital which is capable of making protocols, it is still better to take treatment. At Apollo, we never stopped our facility in the wake of COVID, not even for day one. So we continued our treatment. Yes, we had some patients who turned COVID positive, but most of our patients, by God's grace, they recovered very well from COVID-19 also. But to argue how did they get infection, whether they got the infection in the hospital or whether they got the infection outside the hospital, is a very difficult thing to know. Precautions, the universal precautions hold true for even cancer patients. It's important that we wear a good mask which covers the nose and the mouth, and not just it is below your nose. You don't manipulate your mask a lot. Even if you have to, you must sanitize your hands first or wear gloves and then only manipulate your mask. Even if you have to eat, just lower the mask a bit and eat, and please close the mask as soon as possible. Use all universal precautions and social distancing and hand sanitization. These are the major things that protect you from COVID-19. Last, not the least, it is important that people get vaccinated. Not only the cancer patients, but the people who are at home who are taking care of COVID-19, of cancer patients. It is very important that they must get themselves vaccinated. That is the best bet from protection from COVID and its serious consequences. Earlier, the guidelines were not very clear whether a cancer patient can get vaccinated or not, because cancer patients were excluded from all various randomized controlled trials on COVID-19 vaccine. However, the advisory came in where they said that irrespective of whatever cancer treatment they are on, be it be cancer chemotherapy, be it be surgery, be it be immunotherapy, be it be anything, they all are eligible to receive COVID-19 vaccination. Only those patients who are on very high doses of chemotherapy, they must check their WBC count, that is white blood cell count or complete blood counts. And if their blood counts are in the normal range, even they can get themselves vaccinated. In case their blood counts are low, they must wait for their blood counts to recover and then get the vaccination done. We all understand that the vaccination protection rate may be slightly less, but something is better than nothing. And it is so very well said and holds true in cancer patients in respect to COVID-19. Not only this, we also urge that the caregivers at home of cancer patients should also get themselves vaccinated, because they are the ones who may be moving out and may carry the virus home and give it to the cancer patient. Any delay in cancer treatment is not worthwhile. And this is what we have learned over so many years. The earlier you start treatment, the better it is. However, I must acknowledge one fact that a delay of a few weeks, or a week, or 2 weeks, or 3 weeks should not alarm a patient about chemotherapy or about their cancer outcomes. Usually, cancer is a slow disease. It is not a disease which rapidly evolves. Of course, there are a few cancers which can evolve very rapidly, but then that would account for 2% or 3% of total cancer cases. But usually speaking, cancer is a slow disease. And it is known that a delay of a week, 2 or 3 should not hamper their cancer outcomes drastically. Maybe a little bit, but then you have to choose between the two devils. I would assume that it is okay if the peak is rising and the infectivity rate and the positivity rate of COVID-19 is high, we can skip treatment for a few weeks and then restart. So with this, I think we have addressed few issues that how we tackle, what is our own experience of COVID-19 infection in cancer patients who are on routine chemotherapies, our own experience of COVID-19 infection in severely immunocompromised patients. Of course, they are at particularly high risk. And most patients, cancer patients who got COVID-19 who are on routine chemotherapies have recovered very well without any dire consequences or consequences which are higher than what is expected in general population. Vaccination is the most important thing, and all cancer patients should get vaccination, so as their caregivers, so that you have a universal protection. And hospitals which are following protocols are a safer bet to continue your treatment than hospitals who do not have any COVID facility. Because, of course, if you claim that it's a non-COVID hospital, you may or may not be practicing the protocols. What we have been practicing at Apollo is we do a COVID-19 RT-PCR within a week's time and a rapid antigen test there and then before taking the patient in, as well as of the relative who is accompanying the patient. With this, I think it is easier to know what is your COVID status, because you never know when you get infected, because the initial incubation period is absolutely unknown and you may be totally asymptomatic and not even know. With this practice, we actually picked up a lot of patients who were positive on the rapid antigen test or on the RT-PCR, and we could avoid chemotherapy during the time they were infected. And universal precautions holds true for everybody, and we must obey these universal precautions very, very carefully without compromising them. And if you do that, I'm sure that you can actually win over this particular pandemic and carry on with your treatment very safely. A delay of a week, 2 or 3 doesn't really hamper your outcomes, and but you must not ignore your symptoms and delay treatment indefinitely. I think with this information, I'll hand over it to our Dr. Srinidhi, and we can have some more questions, I think, which will clarify more doubts about this particular topic.
Thank you so much, Doctor. So I just wanted to get back to the basics a little bit. If you could tell our viewers, what does immunocompromised actually mean? What does it mean to be immunocompromised? Is there a particular definition for it, or are there some blood parameters?
So immunity has many folds. It's not that there is one marker of immunity, or there's a thermometer for immunity that you just check that, okay, you are at 99 or 90 or 80. So the immunity has so many folds. So even the layer of skin on the face is a part of the immune system, so that the bacteria doesn't penetrate inside. The saliva that is made in the mouth is also a part of the immune system. The gut lining is also a part of the immune system. This is called as innate immunity. Then immunity can be because of your white blood cell counts, and we know that white blood cell counts are neutrophils and lymphocytes. So there is short-term immunity and long-term immunities. And there is some memory B cells which provide immunity for long-term infections. So when we get a COVID vaccination, we actually train our memory B cells and T cells to fight the infection. So there is no one simple measure of immunity. Whenever we give chemotherapy, our long-term memory B and T cells, they take a hit, but that doesn't mean to say that they become zero. We still hold immunity in routine chemotherapies. So as I said, that there's no one clear measurement of immunity, but if your white blood cell count is low, your lymphocyte counts are on the lower side, then definitely you are immunocompromised. But there's no one clear test or to measure immunity that anybody can just check that, okay, my immune system is robust?
Could you tell us also about what should a cancer patient during this time of the pandemic? Is there something, because we read about a lot of articles and other information these days that people build up their immunity through their diet or through supplements or through other concoctions or whatever. But what can cancer patients do? Is there something that they can do in their lifestyle, whether it is diet or whether it is through any exercises or breathing exercises, anything that they can do to face the COVID infection better if they do get it, or prevent it altogether?
A very good question. I'll break this answer into two parts. One is what cancer patients can do who have finished their treatment and are either no more cancer patients and they are just on follow-up, and those who are actively on treatment. They are receiving some form of treatment. The most long treatment for cancer patient is chemotherapy, so we'll dwell mostly on chemotherapy. Usually surgeries will not hamper the immunity so much. But yes, chemotherapy can. Radiation also does not hit your immunity too much. So let's talk about first the patients who have completed it. So there is no doubt that if you go to the American Cancer Society or any cancer society which updates themselves very frequently, cancer patients, how to build immunity in cancer patients who have received therapy in the past. So it talks about a good diet, a balanced diet, having a good body mass index, that is not being obesity or shunning away obesity, and of course, exercise. About exercise, it is said that what is a good exercise regime? It says that strenuous exercise 30 minutes in a day. And what is strenuous exercise? Is running. Say, for example, many cancer patients would say that we can't run because we were obese earlier or we have some joint problems. Okay, it says moderate exercise for an hour. Now, what is moderate exercise? Like jogging. So a patient may say that even I can't even jog. Okay, light exercise for 2 hours. So the duration keeps increasing every time. So if you have to do light exercise, what is light exercise? Walking. But if you walk only for half an hour, that's not enough. You got to walk either 1 hour in the morning, 1 hour in the evening. Yoga is a light exercise. It's not a strenuous exercise or a moderate exercise. So many people say that we do yoga for half an hour. Well, very good, but then you need to increase the duration. So exercising, good diet and timely diet, good amount of water intake, thinking positively, having a positive attitude towards life is something that is the most important to build up good immunity system. Of course, balanced diet is a diet which has a mix of everything, all sorts of pulses, balance of carbohydrates, a balance of fruits, etc. So all colors of pulses, all colors of fruits, all colors of vegetables should be included so that you build a good immune system, because everything is replenished in some particular vitamin. If you have a red dal, then it is good in particular vitamin because you need all the vitamins, so you must mix and match your diet. Now coming to questions to patients who are on active treatment. Other than doing light exercises, may not be duration of 2 hours, maybe whatever you can do possibly, having a good balanced diet, thinking positive, having a good hydration, and thinking positive is something that you can do. But those who are on active treatment, they also must watch for their blood counts. Usually during chemotherapy, the blood counts can fall down. So what we did during COVID times, we were very, very watchful about their CBC count, that is complete blood counts, that is which includes hemoglobin, white blood cell count, platelets. And we were doing more frequent checks so that their white blood cell counts does not dip down. And we can take corrective actions in case they do dip down so that they don't contract any infection, not only COVID, any infection. Because in today's world, if you have fever, everybody will start thinking of COVID. So we don't want them to have fever for any cause. So we were very watchful about all these things. So blood counts, and we know that there are certain injections which can be done to increase the blood counts, especially those patients who are on chemotherapy. So we were using that slightly more frequently than we were using it in the past, so that their blood counts do not drop down. Other than that, of course, having a good diet, good hydration, positive attitude, and light exercises can go a long way in building good immunity.
Doctor, you were talking about the positive mindset. I think, particularly in cancer, I think, especially in these times when most even people without cancer have all kinds of fears and tensions, could you give us some tips on, how a patient who has cancer, who has conquered cancer, who's fighting cancer, how can they develop this positive mindset during this very depressing time of pandemic and very sobering news on the channels, and then also the lockdowns. So there's a lot of restrictions, a lot of fears. So how can they in particular develop this positive mindset and hope that things will not deteriorate?
That's the most difficult question to answer.
Yeah.
As doctors, we also do get depressed because after seeing all those news channels, it's so very depressing. But I think one has to rise above the difficult times and not watch these channels too much and distract your mind. I think the most important is having a good social support system, and we impart positive energy to others, and so that we get positive energy. So thinking positive and talking positive is very important. And having a good social support system, and of course not watching these negative things too much and rising above them. So reading a good novel, watching something which is more positive, and taking to some music, something which excites you, which makes you happy, maybe exercising, maybe listening to a music or playing or having a hobby, and indulging yourself in that will definitely impart some positiveness. And it is sometimes I ask my patients to, to spoil themselves. You pamper yourself. I mean, maybe buy something good, which you are always thinking of buying, something which excites you, which makes you feel happy and more positive. It's okay. It's okay to do something like that, and which changes your entire temperament. So these are the things which I think can help patients coming out of their negative thought processes.
What about the family, the caregivers, doctor? They are often a neglected group in this whole scenario because they also worry a lot about a person in their house who might be suffering from cancer, and they themselves get so worried about not only the cancer care, taking the person to the hospital. Everything becomes difficult when there is a pandemic going on. So what would you tell caregivers? How can they cope when it's really a twin battle, isn't it, at this time?
Yes, I think the most difficult job is of the caregiver. Much more difficult than the patient himself, and much more difficult than the doctors and the medical fraternity, because he's the guy who has to actually support not only a patient but also take care of himself and settle hospital bills, doing running around. So the health of the caregiver is also very, very, very important, and that is the one which is neglected the most, and we take the caregiver quite much in granted. So I think it's important that they remain upbeat, and they also need to pamper themselves, and they also need to remain positive, eat healthy, eat on time, stay very well hydrated. All these small things can really, and give time to yourself also. And it's okay to share duties, not to take the entire burden on yourself, but to share duties, so that you can, because the health of the caregiver is equally important. We have had incidents, very saddening incidences, where the caregiver actually had a COVID-19 and serious consequences, whereas both the patients were quite okay. So the health of the caregiver is very important. They must not neglect their health because of any reason. That's the reason, if you remember that I stressed upon the vaccination of the caregiver as well. And that was the reason, that was the thing that came to my mind, that it is so very important that the caregiver is also vaccinated, or whosoever is giving immediate care to the patient, they all should be vaccinated. Because we just can't accept a caregiver passing away and everybody else is still okay.
Absolutely. Doctor, what about a patient who has cancer? When they get COVID, are any of these COVID medications, are they likely to interfere with the cancer medication or the radiation therapy or any targeted therapy, immunotherapy, whatever they're taking? Would these medications interfere with that? Or should they be stopped for some time if a person is treated for COVID?
Yes. So the question is that if a cancer patient does get COVID, the medication used for COVID treatment, do they interfere? Sorry,
Yes.
do they interfere with the treatment? So till the time the patient is known to be COVID positive, a cancer patient, their treatment will be held mostly, and we would not do any active treatment unless until they turn COVID negative or they remain asymptomatic for more than 5 days, and at least 10 days have elapsed since they turned COVID positive. Then we can resume their treatment, provided the treatment is considered to be safe. There's no thumb rule over here, but that is the general perception. If you are undergoing chemotherapy, 10 days, more than 10 days have elapsed, last 5 days have been totally asymptomatic, your inflammatory markers such as D-dimer, CRP, etc. are normal, then you can restart your treatment. The medications used for COVID are quite varied. So people use remdesivir. So remdesivir, we don't really think, or if you are at home, somebody may be using Fabiflu, Favipiravir. All these medications are not known to cause any interference with your treatment. However, some patients who have inflammatory surge, prothrombotic inflammatory surge, such patients undergo steroid treatment. And steroids can definitely interfere with your immunity even further. But so one has to choose between using steroid versus not using. But in case you have a situation that you have to use steroids, so you have to use steroids, especially patients who are on immunotherapy for cancer treatment. The effectivity of immunotherapy can decrease if you have to use steroids for COVID-19 treatment. But usually the duration of steroids in COVID-19 is usually about 5 days to maximum 10 days. And injudicious use of steroids should not be done. So there are particular markers of inflammation which has to be used to decide for how long you have to be on steroids. But that is one thing which can definitely interfere with treatment. Other than that, I don't really think that other treatments can really interfere with COVID-19 treatment. The COVID-19 treatment is antivirals, steroids, oxygen, and antithrombotic agents. These are the main pillars of treatment of COVID-19. Of this, only steroids, I think, can actually interfere with the efficacy of treatment, especially with those cancer patients who are on immunotherapy. Other than that, I don't really think that there is any risk posed by any of these medications as far as cancer treatment is concerned.
What about children with cancer? Are there any special precautions that they need to take regarding COVID-19?
So no special precautions. So far, COVID has not really touched pediatric age group very severely. Of course, the most common pediatric cancer is blood cancer. And blood cancer patients, pediatric blood cancer patients are severely immunocompromised. And such patients should take extraordinary precautions. Blood cancer is one disease where you can actually not hold therapy for even 2 weeks or 3 weeks. When I said 2-3 weeks, I was talking of mostly solid organ malignancies such as breast, stomach, lung, colon, pancreas, liver, etc. But when it comes to blood-related malignancies, we generally do not even want to wait for a week. And so pediatric patients, wherein most common malignancies are blood-related malignancies, and they are severely immunocompromised, they need to take extraordinary precautions. Unfortunately, we don't have vaccine approval for pediatric patients yet. And as soon as we have that, they must get themselves vaccinated. Their caregivers must get themselves vaccinated. but there has to be a separate facility for pediatric patients to carry on their treatment. So far, we know that COVID-19 has not really touched the pediatric population, but we need to be aware that the third wave might. And we need to have protocols already set of how we are going to deal with it in case that wave does touch the pediatric population.
So with this, Doctor, I think we are done with the questions. Is there, there's anything else that you would like to add to this discussion?
I think my last and the most important remark would be to maintain a healthy and a positive frame of mind. I know these are very testing times, but as desperate is the situation, we must use all desperate measures to keep ourselves upbeat, positive. And we know that it's not only that India is suffering, the entire world is suffering. So we must acknowledge that we are part of the world. So all sorts of suffering will come to us also. But we must try to live up to it, fight it, and not lower our guards. And till the time we have more healthy and more positive times coming in, and which will surely come, we need to be slightly patient and allow the authorities to work in our favor, which I'm sure they are doing. And as far as Apollo hospitals are concerned, we are trying to upgrade ourselves with every passing day. And we are having protocols laid out. We are revising the protocols as is indicated by ICMR and the Government of India. And we are following all possible norms to keep our patients healthy, happy, and safe.
Thank you so much, Dr. Singhal. That was a very, very illuminating and detailed discussion. Viewers, if you have any questions, please put it on Facebook Messenger, on the inbox, or comment on the page itself. Tomorrow, we will be discussing the critical care management of COVID-19, and this will be discussed by Dr. Himal Dev GJ from Apollo Hospitals, Delhi. Meanwhile, take care, be safe, be calm, and don't forget our code word of SMS, which is social distancing, wear a mask, and sanitize always. Take care till I see you tomorrow. Namaste.
Namaskar.